Dear listeners, it wasn't until my discussion with social worker Carol Sandell that I realized how elders face loneliness and isolation in a very unique way, where they drift deeper and deeper into it. Please listen in to the following interview. Well, Carolyn, welcome. It's really a pleasure to have you, and I'm excited to start talking about your experience and engaging in this conversation. Well, we should start off with, I was telling you that I've been in public health. I've worked alongside therapists and mental health counselors and psychiatrists throughout the years, and I reach out to some of them, and they did not know anyone who focuses or specializes on mental health senior services and counseling. So we were talking about that, and you were saying
that's not surprising at all, because that's part of the reason why I opened up my practice, is just because there isn't enough services out there. And I experienced a lot with COVID. During COVID, I was running a assisted living in the Boston area. And they went through, my residents, so much decline and depression and loneliness, and really needed support and couldn't find anybody. Most people don't want to work with older adults, or maybe if they do, they don't really have the background or the knowledge of the things that they go through. And there's really such a need. I mean, as soon as I opened my practice, I was full within maybe 2 to 3 months with a waiting list. I wish I could. Yeah, I wish there was 4 or 5 of me, and I'd probably be still full.
Wow. Yeah. I sit on the board of a federally qualified health center, and the lack of mental health providers, it's so overwhelming to fill these roles, and also the pay. It's another issue too that I've learned about through this process. And I think, as you talk about it, there's so many different sectors or communities or subpopulations. And as you were talking about for older adults, the need, I think, is also greater, and it's sort of a missed opportunity. So before we continue, please share with us about your background.
Sure. I'm a licensed clinical social worker. I've been working pretty much with older adults for about 25 years. I kind of got it in by accident. When I was in my master's program, really didn't even think about working with older adults. And there just happened to be my internship. Something happened with my internship, and the only thing open was working with older adults, because those were all open. And I fell in love with that. I fell in love with working with that population. Just felt like I could learn so much from them as well. So I started out as a social worker working in senior housing. And then from there, ended up running nonprofit assisted livings in the Boston area. And so I was able to kind of help with strategic planning and kind of see things from the other side. And then COVID happened. And COVID was probably one of the most challenging periods of my work career. And in my life, probably. Yeah. It was really challenging, and really saw how my residents really were affected by that. Depression, isolation, loneliness, and other things had come up from that. And trying to find support for them was so challenging. And so that's why I decided I need to change. I missed kind of working on that one-on-one with people. And so that's why I decided to open my practice.
Wow. So share with us the different types of services that you provide for the audience who may not be familiar with therapy. And I know that there are different types of or styles of therapy, right?
So there are very different styles. My approach is being where the person's at, because everybody is so different, and what something might work for you might be different for somebody else. So I really kind of start off as like getting to know somebody, developing, you have to have a good rapport and a good relationship. I do a lot with mindfulness, quite a bit, which surprisingly enough, I was very shocked of how many older adults who meditate, which I think is wonderful. But I was very shocked to know a lot of them are very interested in practice mindfulness. But I do a lot of CBT, trying to do some kind of...
What's CBT again? Cognitive
behavioral therapy. Yeah. So kind of just re-looking at how your thoughts right? And just trying to look at reframing thoughts or seeing, are these thoughts really true, right? Having people
Right.
really look at that and just,
Oh, great.
yeah. So some of my
Yeah.
approaches that I use.
Oh, great. So tell me, what has been your experience since you started the practice? And you talked about the pandemic, and maybe there's so much we can just talk
I
about just pandemic, exclusively. But what have you experienced? I guess in your practice, what do you feel? What have you experienced, and what are you learning about them in terms of mental health
Sure.
and health-seeking behaviors,
Yeah.
diagnosis?
I mean, I work with this kind of a few different types. I feel like if you put people in more categories, is, I've been working with people who've been just diagnosed with Alzheimer's.
Oh, really?
So kind of, yes, trying to process and grieve that piece. I work with people with Parkinson's quite a bit as
Really?
well.
Okay.
But I think a lot of it too is what I'm seeing is the isolation from COVID. So before COVID, a lot of these clients or older adults, they were going to the senior center, they were leaving the house, they're going out for lunch, seeing friends. They didn't even think twice about leaving their house. And then all of a sudden,
Yeah.
we're in lockdown. They can't leave. They're scared. They already have certain illnesses that if they get COVID, they're worried, could I get sick? Could I die? They're seeing their friends die or family die. So they're terrified. So all of a sudden they're
Uh-huh.
in their home. Some of them they're by themselves. Maybe there's a spouse. And so they spent a good, 2 years or so, pretty much in
Yes.
isolation. And then all of a sudden, okay, we can start coming out. They don't know
Hmm.
how to. A lot of them end up feeling stuck.
Oh, really?
Yeah, because when you've been home for so long, their confidence goes away.
Oh,
And so
wow.
they feel nervous leaving their house. They feel nervous that could they still get sick? Can they
Mhm.
still, a lot of anxiety comes up, just nervous just leaving the house because they haven't been doing it for so long. A lot of their friends have aged or passed, and so they've lost their community. And so there's a lot of isolation is what I'm seeing a lot, and depression and anxiety quite a bit.
As you talk about Alzheimer's and Parkinson's and the sense of loneliness, I'm reminded of an interview I had previously with you where Stephen, while taking care of his partner, talks about that sense of loneliness as a
Yeah.
caregiver as well. And now I'm hearing this is also the experience of the actual person that elders in general, either we must introduce him.
This is Louis. He is, I guess, my therapy dog. He's my coworker. He's usually on my lap with me. My
Oh,
clients love him. Yes, yes.
wonderful, wonderful. Well, if Louis, if you want to have something to say,
Um,
please, you're more than welcome. But the sense of loneliness I'm hearing for caregivers as well as for the actual patient or the client, right? As you just shared. And what I guess my question is, what then do you do, or what do they do when they're experiencing this? And you're right, because as we age, our friends may not age as well or unwell throughout this experience. People pass away, people leave. And so to me, the loneliness becomes more apparent or severe.
Absolutely. Yeah, absolutely. It's tough. It is really tough. I think a lot of times my clients are very excited to talk with me because I'm really their only person, maybe, that they do talk to.
Wow.
I try to work on with some of them about really trying to get more, how can you get involved in the community again? What do you feel comfortable? How do you feel safe? And trying to encourage, find out what their resources are, what are their strengths, like how can I help them connect more, find relationships and connections, because we need that.
Yes, yes, yes. And do you think that is it something that sort of led to the loneliness, or maybe what can they do to sort of prevent it from getting more and more severe? Because,
Yeah.
like, we mentioned so many things change in your life as you age,
Hmm.
right? And we also see too, I mean, I remember growing up in New York City, I volunteered once at New York Cares, the organization, and we were delivering food for homebound
Yeah.
elderly clients and patients. And Is there like a loneliness prevention model, if you
You
will?
know, before COVID, there were friendly volunteers. There were people going to,
Really?
yeah, people would go to people's homes who were more homebound. I think there was a lot more services out there. The services that were there 4 or 5 years ago are no longer there. You know, there used to be even like day
Wow.
programs for people to go to. You know, they'll pick them up and bring them. So if someone was frail or couldn't get there, there were services. And people don't want to work in the industry as much anymore too, which is just, it's, I think, because of COVID.
Yeah, yeah. So, and that, I guess it sort of dissolved these opportunities or these forums and the sense of community that they had. What have you experienced in terms of their mental health seeking behaviors?
You mean as far as actually reaching out? Yeah.
Yeah. And also, just to add to that discussion, the type of assessments, and I'll share with you from my personal experience with my mother what the lack of assessment that after she experienced some grave physical setbacks. But yeah, share with me
Yeah.
about their mental health. How do they go about seeking services and
It's a struggle for them. You know, it's a combo. I do get family members reaching out for me for on behalf.
okay,
That does happen because it's also, I think, harder because everything right now is online. So it's harder sometimes
yes,
for them to be able to navigate and they feel overwhelmed because there are so many providers and they reach out and nobody gets back to them, you know, or so it's hard. I do have a fair amount that are somehow I think got me through a doctor's office or more of a referral base. But some can, you know, do the Google searches and we're able to find
yeah, yeah,
me. But there are people who
yeah,
call and I've been looking for 6 months, a year. No, get that
really,
quite a bit.
wow,
What I'm also kind of seeing too, which is interesting, is I have a kind of a small cohort of clients who they're therapists who they've seen actually 20, 30, even 40 years. They're retiring. I think there's this group of therapists after COVID, they're deciding to retire. So then they can't find someone to take over, you know, that treatment.
yeah. Oh, yeah. That's a great point, right? Like having that relationship with someone for so many years and then they retire and then you sort of have to
A
almost like
loss.
starting from,
It's another loss for them. They have a
yeah.
hard time with that. Yeah.
Yeah. And I would imagine that would be a very difficult shift because you had this
Oh,
relationship
yeah.
with someone and then you have to start all over
Yeah,
again, right?
right. They get stuck with me, and yeah,
Yeah. Yeah, yeah, yeah.
different.
It's interesting that you also mentioned that the family or caregivers will then reach out to you as a means of connecting with them or establishing the care because they may not know how to navigate the online system. And as much as the apps are there and it's overwhelming, I think. I would imagine that, and I think I've mentioned this several times in my discussions that COVID was a perfect example. They wanted the population at risk or at high risk, the aging or elderly population, to get the vaccine
Mhm.
first. And they rolled it out online, and it was absolutely impossible for them to get vaccinated.
Yeah,
So then you had family members and loved ones stepping up to register them online. You had to refresh your
right,
screen at 1 o'clock in the morning.
right.
And it's just an absolute nightmare. So I would imagine something very also similar for seeking mental health
Oh,
services.
absolutely. Yeah, absolutely.
Yeah, wow. And if you don't have, I mean, yes, we know that it's reliable and it's a great resource to have online and the internet and the virtual space. But for these populations that fall through the cracks, like
Mm,
we're not doing the heavy lift,
no, there's a
right?
lot that are falling through the cracks, and because they don't have family, right? So there's nobody really checking in on them. And it's not until
Yeah,
it's too late where maybe, you know, they had a fall or there's a medical emergency and then the paramedics come and they see the condition. But a lot of times now they're just still sending them back home, you know,
yes,
because they don't have the
yeah,
resources they
yeah.
used to.
And I also found, have they spoken about sort of the state or local Office of Aging, if you will, and what has been that experience with them, sort of navigating that? Because I tried to navigate it myself to like find information so that I could put on my website that would be useful. And it's just very overwhelming, you
Are
know?
you talking about the Executive Office of Elder Affairs? Is that what you're talking about? Or are you talking about more?
Yeah, like, government
Oh,
agencies, yeah, local and state government agencies, that to provide elder care and elder
mm,
services. Like,
yeah, they don't have.
yeah,
I've had people who've reached out to them and no availability. They don't know when. Yes,
yeah,
yeah.
yeah. So talk to us about what is that like, the insurance, how, your experience with that and, and
Yeah.
payments and yeah,
Yeah, I mean,
what's,
working with older adults, mostly they're on Medicare or Medicaid. And I think that's another reason why a lot of other clinicians aren't working with older adults because Medicare pays significantly less than some of the commercial insurances.
yes,
And I think that needs to change. But most of them, people I work with either have a no deductible or very low deductible. So it is affordable for them.
okay,
I think if they did have to pay a higher deductible or co-pays, a lot of them are such on fixed incomes. I don't know if that would be possible. So I think at least that piece is helpful for them. But if other providers would start taking Medicare or if Medicare would start increasing their rates, I think there'd be a lot more therapists who would be willing to work with that population.
yeah. The other thing that comes to mind is the different type of client population
Mm,
that you may see or have to then politely decline because they may not, for instance, English is a second language.
mm.
For instance, what's that experience like?
I haven't had that experience, and I'm wondering is because if they haven't been able to reach out to me to be able to communicate
Mhm,
that.
mhm,
But yeah,
mhm.
I
Yeah.
haven't.
Yeah, I worked a few years ago. I worked on a study looking at senior South Asians.
Mm,
And that we focus on, there was a needs assessment done with over 1,000 senior South Asians in the New York metropolitan area. And the needs assessment looked at their mental and physical
mhm,
needs. And we wanted to hone in on mental health and to see what that's like. And one of the things that we discovered is that in their native language, and senior South Asians would be people of Indian, Pakistan, Bangladeshi, Sri Lankan origin, or Caribbean if you have ancestry from one of those
mm.
countries. And they did not have in their native language a definition for feeling depressed.
Oh, interesting.
Yeah. And what we found was the Caribbean East Indians were the ones who suffered loneliness more severe than any of the
Huh.
other
Wow.
groups within that cohort. Yeah.
Yes.
What sort of diagnoses do you encounter? Do they have previous diagnoses like, uh,
Some do. Like I have a few who've always had a history with mental health, and maybe has a diagnosis of bipolar disorder. But a lot of them are. It's mostly depression, anxiety. Mostly, it's a lot of loss. A lot of loss, grieving, kind of that.
really? Yeah.
I tend to work with also a lot of LGBTQ community. I identify as gay, so
Mhm.
I think they kind of start gravitating to me as well. I do see a
Yeah.
lot more isolation in with that population, quite a bit.
Well, I'm happy that you share that because as the more interviews I'm doing and the more research I'm doing and the more investigation I'm doing, I am realizing more and more that it's such a huge gap
Yes.
in LGBTQ
Yep.
seniors and the services for them around mental health and just healthcare in
Mhm.
general, elder LGBTQ plus elder care. It is dramatic need for
Yep.
interventions and services dedicated towards that population. And can you share with me a little bit more about that experience working with them and how is it different from non-LGBT?
Yeah, absolutely. I mean, I think with that population, you have more people that they don't have children, maybe haven't been married. And so they really rely, I think, a lot on their community. And I think since as they've gotten older, their community has gotten frail or have passed. So there is a lot of isolation and loneliness. There's also not as much supports, like places for people to go.
Yeah.
They feel, I don't know why I'm blanking on the name, but I worked very closely for quite a few years. I think they're out of New York.
Sage?
Thank you. Yeah, Sage. I worked with Sage. Sage. I actually worked with very closely when I was running the assisted living in Brookline. We became the first assisted living in Massachusetts to become Sage certified.
Oh,
That was
wow.
amazing because they were really able to train our staff, but also the residents. And we had these open discussions about what is it like to be LGBTQ and trying to have an inclusive community. And I think that was really important. But there's not a lot of services out there. And I think some, especially older LGBTQ, they're more likely to go into the closet quite a bit, especially if they needed care because they feel, am I going to be treated differently if they know that I'm gay? I see that quite a bit.
Wow. So the lack of elder care, LGBT services, sensitivity, training, awareness, education. It's interesting. One thing that comes to mind is the trauma.
Mm.
And I think you'll appreciate this. And I could just think about the LGBTQ folks who were my mentors and who are pioneers in the industry.
Yeah.
20, 30 years ago. And I wonder if they went through a very difficult time as an oppressed group. Before that, before gay marriage, before this sensitivity around LGBT issues and training and education and the abundance of healthcare services, within the urban or New York population, I would say, or New York community. And as I'm thinking about it, this sense of trauma that they've experienced as an oppressed group, and then the AIDS, HIV and AIDS epidemic, and then some of them are the whole issue of survivor guilt, and now HIV lifers who have been diagnosed for 20, 30 years or more. Yeah, what has been that? I mean, I would imagine, right, that they would have this trauma that they would have to, as a community, have experienced and could have to sort of deal with.
I kind of think that's why some of them end up going back into the closet.
Yeah.
Yeah.
It's funny because, as much as it is sort of common, if you will, or accepted, I would say, within the medical community, and depends on where you go and where you live, it is a real challenge.
Yeah, absolutely.
So I could see why they fall back into sort of that mode of being sort of closeted or not really wanting to disclose. And then we know that that also puts them at risk, right, for certain diseases or the lack of screening, right, for certain diseases.
Yeah, that is true. Yeah.
As well. And then the other thing that comes to mind is it's narrower and narrower as they get older because you're a subset of the population, right? And then you're growing older, so much of your friends and stuff are no longer around, family members.
Yeah.
And like you said, they don't have kids. Their family is also extended in a sense of community.
Yeah, absolutely. When I was in the assisted living, and we were we did the SAGE, and we did have a small, which was great, group of residents that came. They're LGBTQ because we went through this SAGE training. But I remember we had this one gentleman who had just recently lost his husband after 30 years, and he immediately went back into the closet. And as staff members, we knew,
right?
But he, I think, out of fear, he just had a really hard time being open. Like he would call his ex-husband his wife out of this.
Right. Fear. Oh, wow. Really?
Yeah. And we tried working with him. I think it was just this ingrained in him, this fear. If I come out, what is that going to look like?
And also, too, I would imagine that societal norms don't make it
Yeah.
easy for them because you go somewhere in a social function and they're like the first thing people would say like, oh, if they ask, are you married? And oh, I
Right.
wonder what does your wife think? And how does your wife feel? Or how does your husband feel if it's a woman? Like things like that. And I would even imagine to take that sort of a step further. Have you experienced trans or transgender senior, LGBT senior?
Trying to think seniors. I haven't yet.
Okay.
I've known, but I haven't worked with anyone who is trans.
Yeah, because I would love to learn more
Yeah.
about what that is experience is like. The other thing that I'm thinking of is quite often, and I know from sort of the HIV care
Hmm.
model, this sense of establishing this community of care.
Hmm.
If I'm seeking mental health services and I have a mental health provider, then and say, for instance, I may need treatment, then I need to see either a
Hmm.
psychologist or a
Yeah.
nurse practitioner and or primary care provider and have sort of this sort of
Yep.
team
Yeah.
of care. And what has been their experience doing that and establishing that?
I think before the pandemic, that was happening more, but it's not really happening as often anymore.
And do they know to do that?
No, I don't think so. I mean, I do sometimes if I have clients with no family members, I will help almost like as a case management, kind of help guide them, help get them the support that they need. I mean, I even do home visits sometimes as well. And I will meet
Oh,
their
really?
physical therapy, their physical therapist or other providers because there's nobody, you need that. You need sense
Yeah,
of a team, community to help,
yeah,
when there's
yeah.
a few different things going on with them. And they don't.
Did we talk about that, having a team? And I think that's a good point too, that it's more case management. So it's just sort of it's another method or different type of service,
It
right?
is.
The case management versus the actual therapeutic, right, services.
Right. And there is. And I think it was one of the talks I had listened to with the attorney. They were talking about geriatric care managers, which are
Yes.
great, but they're really expensive. So most people can't afford them. They're anywhere between 150 to 250 an hour. And they're
Really?
like attorneys
Wow.
and they'll just keep billing after every single call or, they
Yes.
can't afford that. Most of the seniors I work with can't afford that.
Yeah. So what would be the option, right?
I kind of step in sometimes because there's no other choice, or I get permission. Can I call your daughter? Or there is family to get them the services that they need to kind of help with that.
Wow.
So it's
Wow. Yeah. It's
more than just, the traditional 50-minute therapeutic session because there's resources that they need a lot.
yeah. It seems as though it's sort of confounded by so many social issues, physical issues,
Mhm.
environmental, that really makes things availability of healthcare services where they live and
Yes.
getting there
Uh-huh. Yeah.
is an issue as well.
To get home care agencies to come in is usually like a 6 to 8 month wait. And then when they get somebody in, they don't show up or they quit. And so then they have to wait for another person to come. They're just
Really?
really not able to access services that they need. Where before COVID, this was more available. I think there was more of a team approach. I would see more people going into more high risk seniors and going in and doing home visits and trying to get them the support. It doesn't happen really as much anymore.
Yeah. And then there's also issue of home health.
Mm-hmm.
Have they talked about that? And what do you know about that? Or what's the
Kind
experience?
of the same. I think if you have money, it's much
Hmm.
easier. It's hard to find good people now. I think, again, like since COVID, a lot of people have decided to get out of the industry. So there is a lack of it. It's kind of the same thing with therapists. It's a lot of calling around and seeing if you can find somebody. And if you're low income, it could be 6 to 8 months wait to get somebody in. And this is someone who maybe can't take a shower on their own or not safe and they need the help. And so they're missing, even just self-care and just basic hygiene and they can't access.
In New York State, there is, and I don't know if in every state this is available, but I know that in New York, we have a
through the Medicaid, I think, or home health agency services where you can hire a loved one
Mm.
to take care of you. I think it's a total win-win and a benefit. Is that available to?
I know, like, I think some who from veterans, I think there might be some
Yes.
money there, but I think that's the only time I've really have seen it. Or if somebody has if they got a very good long-term care insurance, they,
Yes.
that, sometimes,
Oh, so again, it's the haves versus the
right,
have-nots, right?
exactly,
There's those who have the money to afford these things, and they they'll have these options.
hmm
But in New York, I know I'm almost certain for Medicaid patients, they can, and I want to think Medicare too, they can hire a family member. And that family member, the agency has to vet them
yeah,
and they have to report the type of services that they're providing. And, I think a lot of families do not know that. Like,
Mhm.
for instance, when you're running errands for your
Yeah,
parent or your loved one, or grocery shopping, or taking them to appointments. I mean, that's time, that's money out of their lives and their schedules, and that can be compensated. And I think that they may not even need the money, the person that's doing it, but if they were to get that payment, then that can sort of go towards covering other costs, right? You
absolutely,
know,
yes,
where I see it's a win-win,
yeah,
and especially when, like you said, the clientele and the population that you work with who have a very limited
right,
budget.
right. No,
And
I could see that being successful for some.
yeah, it's very
Yeah.
successful, I think, in New York when I just hearing about it. And the other thing that comes to mind is issues that you have experienced of food insecurity and lack of
Mm,
transportation and other, can you talk a little, or competing needs, if you
yeah.
will?
I mean, definitely, I think transportation is huge, especially a lot of older adults who aren't driving anymore, especially being like in a Boston area too. I mean, they do have things like the ride. I don't know if they have something similar, I'm sure at.
Yes, yeah. We have a accessoride, we call
Yes,
them. Yeah.
yes, but they never show up when they say they're going to show up. They often wait for hours, so they don't want to take them. Transportation is huge, and it's also they can't afford it a lot of the time. They don't have a smartphone, so they can't just call Uber.
Yeah, and they don't know how to use a
They don't know how
smartphone.
to use
Yes.
it, right? And so there is a definitely a lack of services as far as transportation. Because I think then I mean, I know quite a few of my clients, I could see if there was somebody that would actually come and pick them up, they might go to the senior center for a few hours and not just go to
Wow.
doctor's appointments. So I think that definitely would be very helpful. I mean, as far as food insecurities, I think more is access to be able to, especially if they don't have families, they're relying on friends, or maybe they're getting Meals on Wheels delivered, but
Yeah.
those aren't very wonderful to eat, or, they're not the greatest, but it's just,
Yes,
I think
yes,
more
yes.
hard accessing. How do they access? And as you
Yeah.
know, all the inflation and the costs have gone up quite a bit. Yeah.
Yeah, absolutely. And that's put them in a deeper
Yes.
hole.
Yep.
Yeah,
Yeah.
yeah. They're not just psychologically isolated and lonely, but environmentally as well, right?
Mhm.
Physical space
Yeah.
and
Mhm.
socioeconomically as well, right? That's what I'm
Yeah.
hearing as
Yeah.
well. That's really sets them really further into a deeper hole of
Yes,
loneliness. Yeah,
absolutely.
yeah.
Yeah.
It's I can't help but really think about what it was for my mother when she was diagnosed with breast cancer,
Mm.
and that experience with the conversation between the
Yeah.
surgeons and so what have you heard about that
The
interaction
white. Yeah.
between and health literacy and language
Yeah.
and communication?
What is it called? Is it the white coat syndrome? Is that what they call it? Sometimes?
Yes,
Yes.
yes.
Yes. They go and they feel like they're not being heard, or they get nervous. And so they forget what they wanted to ask them. They talk so quickly. They kind of
Yes.
like, okay, yep. let's get out of here.
Shuffle them out.
You know,
Yeah.
I'm hearing now, I think it was with Medicare, they're not actually really doing yearly physicals anymore. So it's wellness exams. So they're doing a full comprehensive physical. They feel like primary care doctors are now just referring out. So they don't have, they're used to having a doctor that they've seen for 20, 30 years who knows them, who knew their kids, right?
Yes.
They don't have that. They don't have the resources to be able to, for a referral, how to go beyond and get that. Or they call the place for the referral and they say, well, it's an 8 months waiting list. And they said, well, I have this lump or I have this going on. I can't wait 8 months. And they don't give them any other options. So they just say, okay, I guess I have to sit and wait because they don't really know or have the capacity or have someone to advocate for them.
For them. Yeah.
I see that happen so much. And
Really?
it's so sad. Yes. That they're not able to get the health care that they need because it's so hard to access. Like every time, right? You call doctors and got to press, dial 3 or all these different paths to get to actually talk to someone. And then they say, well, use the portal. You got to use the message through the portal. And, it's a circle. It's just, I feel so terrible. It's so hard. It is.
I have my own headaches with that portal.
Me too.
I have nightmares about portals.
Me too.
I must say, though, the Veterans Portal is absolutely fantastic.
Is it?
Yeah. And again, I tap into different types of services. So again, the portal, but the Veterans by far has the best. So far, it's easy to navigate, but you're right. So like this, I also found that the time to make a decision on something that's a life-changing event. My mother had less than 15 minutes in the surgeon's office to decide whether she wants to have a mastectomy or a lumpectomy.
Wow.
15 minutes.
Wow.
And the night of the surgery, I asked her to tell me what she thinks, what she's good to have.
Mm-hmm.
And then I said, then she was set for a lumpectomy. But the night before, she decided she does not want that. She does not want to, she wants to reduce her risk of chemo, reduce her risk of radiation. And to do that, it's advised that you have a mastectomy.
Mm-hmm.
Now, she did not get or understand what these risk category means and the different options that were available.
Yeah.
So on the day of 5 o'clock in the morning, scheduled for a lumpectomy, she told the surgeons, I don't want that. I want a mastectomy. And then it dawned on me that she had only 15 minutes 3 months ago to make that decision.
Wow.
Not knowing what's happening and the risk involved and sort of evaluating that and weighing all this. Now, on the day of the surgery in the pre-operating room, they had, a team of physicians, and they're talking to my mother and of very limited education background. And they're talking to her as if they're talking to a peer. And someone realized that she wasn't really connecting, like it wasn't going through. And they asked her, do you understand what I'm saying? Why don't you tell me what you think I said?
No.
She couldn't speak. And it took one physician or surgeon to realize that and then explain it to her in the level that she could understand, in the midst of all of them.
Wow.
And that is really an issue that I'm seeing over and over again. Yeah. And especially with Medicaid recipients who may not have that background, may not have the knowledge, may not have the experience. And as they get older, to have someone to advocate for them, to learn how to navigate it. I can do it because it's part of my specialty, right? It's part of what I do for a living, right? And being able to sort of communicate to the provider, we can do that as professionals, right? But and I think that sort of adds more to that loneliness as well.
Yeah, absolutely.
And isolation.
Yeah, absolutely.
Where it really makes it difficult and, for them to even make a decision and to understand my problem is to understand the decision that you're making,
Mm-hmm.
right, as an elder.
Right.
Like, what do you understand the decision that you're making
Right.
here,
I don't think a
right?
lot of them do.
Yeah,
Yes.
yeah.
Yes.
You know,
Quality of life is very important at that age, right?
and then you alluded to the discussion, the interview I had with Laura Ford,
Yeah.
the attorney. And one thing that resonates to me consistently is dignity.
Mm-hmm. Absolutely.
And she described that really eloquently in the interview. And I can't help but think about that too in the mental health space and the access or health seeking behaviors among elders, and where's the dignity there for
Mm-hmm.
them. And that's a huge lack of that,
Yeah.
of getting that support that they
Mm-hmm.
need. So
Yeah.
I think we talked about a lot. So is there anything else you'd like to add or
Sure,
share?
I could talk for another hour or two, but no, this was great. This was great. I mean, no, this was great. It was a great conversation. Thank you.
Yeah, I appreciate your time. I appreciate your experience and you volunteering to share your story. And there's so much nuance in the mental health space
Mm-hmm.
and sort of bringing to light, some of the challenges and also highlighting some of the subset of the population, like the
Yeah.
LGBTQ plus senior community and what they
Mm-hmm.
face and what it's like.
Yeah.